Hey everyone, Nate here, Hill and Ponton's video guy. Today we're going to be talking about hiatal hernias, and today I am joined with attorney Rachel Cheek. How you doing, Rachel?
Hey, good. How are you doing, Nate?
Doing pretty well. Doing pretty well. What is a hiatal hernia?
A hernia of any type is when a muscle wall or like a tissue wall becomes weak and you have a bit of organ, like whatever it may be, pushing out. So, say this is your muscle walls. If they're weak or they become separated or injured, pushing out where
Yeah.
normally it should be contained. It's a very common thing for people to have hernias. So, most of the hernias occur kind of lower down abdominal wall type area.
Yeah.
For hiatal hernia is a little different and it's rated differently than any of the other hernias because of where it's located. So I don't know if you ever took chorus or sang in a choir or any type of like singing lessons.
I did musical theater.
Okay, well then you probably know about the diaphragm.
Yes.
The muscle, it sits under your lungs and it helps, control your breath or
Yes.
push your air out.
Helps you be louder.
Helps you be louder. Yes. Exactly. When you have a hiatal hernia, your stomach actually pushes through the walls that normally would be like your diaphragm. As your esophagus is where your food travels, you swallow your food, it goes down your esophagus. If there's a rupture or a hernia in the diaphragm, your stomach can actually come up pushing into your esophagus. Yeah, exactly. A lot of other symptoms just besides pain. You're going to have reflux, you could have regurgitation, heartburn, trouble swallowing, feeling like there's a lump in your throat. And think about it, literally there is.
Yeah.
Like
Yeah.
if you have that kind of hernia. So there's a lot of different things. It can obviously affect your eating and your
Yeah.
nutrition. If you're having so much pain or difficulty swallowing, you're going to eat less or you're going to eat different types of food that you really have to kind of change your life day to day
Yeah.
to deal with it. This hiatal hernia may sound familiar to people who had ratings for GERD under the old rating system. It was early 2024. The VA changed the digestive conditions rating criteria. Anything to do with the esophagus, the stomach, the intestines. Hiatal hernia comes into that. GERD or gastroesophageal reflux disease. That condition used to be rated as hiatal hernia. The hiatal hernia is like ringing a bell for some reason. It may be because you already were connected for GERD and that's the rating that they used. But as I said, in May 2024, the VA changed some of the ratings for the digestive criteria. So now hiatal hernia has its own different rating criteria. GERD has its own specific rating criteria. It's no longer rated the same as hiatal hernia. So they are separate now.
What are the ratings that people can look to have for hiatal hernia?
I think if you can't eat, that's a huge factor in how it changes your day to day life. As far as ratings, they're going to depend on treatment types and they're going to depend on symptoms, of course. So, first one is going to be if you have a diagnosis of hiatal hernia, but you don't really have any symptoms. I suppose that could happen. I'm not a doctor, but just thinking about that, it makes it hard to imagine like you wouldn't be able to feel anything. But if you have diagnosis, no symptoms, you don't need medication to control it, 0% rating. If you've got a documented history of esophageal stricture, basically, if you have hiatal hernia, you got to take medication and it's been documented, that's a 10% rating. We go up to 30% if you have the hiatal hernia with difficulty swallowing. That counts. It requires you to have dilation of some sort 2 times a year. So that can either be physical, like dilation, just meaning making the esophagus bigger. It can be medical. It can be through steroids. That is where I have been running into problems when I'm trying to look to see like how my clients should be rated. Maybe they have all these symptoms, but they don't necessarily have the dilation. It's kind of hard for them to get a rating that's any higher than 10%. 50%, they do know if you need dilation 3 or more times a year. Also, dilation, as I mentioned, using steroids.
Yeah.
If you have to do that just once per year, you can get a 50% rating. Now, to keep that 50% rating, you would need to have that done at least once per year, the steroid treatment. That seems to me a little more less invasive and more attainable treatment. Or if you need an esophageal stent placement, that's also 50%. In any case, that's all the 50% criteria. It's either or. So you don't have to have the physical dilation and a stent. It can be one or the other, or the steroids once a year. So 80% is the highest rating, and that is going to require obviously more substantial symptoms. So you're going to have the documented stricture of your esophagus, which causes aspiration. It means when you breathe in things that should go in your esophagus. So you can aspirate water, you can aspirate food. Very bad. You don't want to do that. You don't want to get the pipes mixed up. But obviously, if that's happening, that's pretty severe. That's going to be an 80% category. You also need to show undernutrition if you're not getting like the proper vitamins or the proper things that you need in order to keep yourself healthy. If you're not getting the proper nutrients, you're probably going to lose weight. And I say substantial weight loss. That is how VA defines it. And they define it pretty specifically. You have to lose 20% of your baseline weight, whatever that baseline is. You've lost 20% of it and you've kept it off for at least 3 months. This is not like weight loss that you're trying to have. It's weight loss to the point that you're weak. You cannot complete your daily tasks as well as you could before, either for yourself or for work tasks. You're going to be tired. You're going to maybe not be able to work as much. All types of self-care tasks can be impacted by that. Sometimes you don't want to lose weight, and especially not if you're losing it like this. In addition to these things, so you can either have aspiration or undernutrition or substantial weight loss. If you have the substantial weight loss, you have to show that it's been treated either with surgery or a peg tube right into your stomach. You are being kept alive. Obviously, that is a huge diminishment of quality of life.
Yeah.
80%, needs to be given for that.
So if you do have any further questions on hiatal hernia, just drop them in the comments below, and we'll do our best to possibly make some shorts that will address the questions that you have specifically. There's also a link in the description where you can click and read more information on hiatal hernia on our website. As always, hit that subscribe button, the like button. Thank you for watching, and thank you for your service.